Good.
Good. My name's Carly. I'm going to be your nurse today. We're just going to be doing a few assessments on you today, okay?
Okay.
Alright, providing privacy, doing hand hygiene. Like I said, we're going to be doing a few assessments, and that just includes your respiratory and cardiac assessments. And from your vital signs earlier, your respiratory rate was 16 and it was regular, so everything's good with that. It was non-labored. Do you have a cough at all?
Yes.
You do have a cough? Okay. Are you producing anything out of it? Like any sputum or mucus?
Yes.
You are? Okay. Alrighty. And then are you having any shortness of breath at all?
No.
No shortness of breath? Okay. So I'm going to be listening to your lung sounds. Every time I put my stethoscope to you, we just breathe in and out for me, okay?
Okay.
And typically we would do this against the skin, but for privacy's sake, we're going to keep the shirt on, okay?
Okay.
Alrighty. Ooh. Alright, right here, I'm going to be listening to the right upper lung. Okay. The left upper lung. Okay. The left lower lung. Alright, and the right lower lung. Or right middle lung, I'm sorry. Okay, could you do your hand like this for me? Right now I'm going to be listening to your left lower lobe. Or right lower lobe, I'm sorry. Okay, same thing on the other side. And that left lower lobe. Okay, I'm going to be listening to the back here. Right here, I'm listening to your left upper lobe. Breathe in and out. Okay, that right upper lobe. That right lower lobe. And that left lower lobe. Alrighty, everything sounds good with your lungs. There's no crackles or wheezes or nothing like that. Everything sounds clear. And there are a few exercises that we have patients do. The first one would be the turn, cough, and deep breathe method. And with that one, where you would be laying down and we would turn you on your side, we're going to have you cough and take a deep breath. And what that does is just expands those lungs, gets rid of any secretions, and it's just a good exercise to get those lungs breathing or working. And you want to do that about once every 1 to 2 hours. And then the other one we do, we use an incentive spirometer. It's a device that you're going to inhale in. And what that one does, it just expands your lungs, get them working. And you want to do that one about 10 times an hour, but not all at once because it can make you really woozy, okay? Alrighty, next we're going to be doing that cardiac assessment. Are you having any sort of chest pain at all?
No.
No sort of chest pain? Okay. Could I see your fingernails here? I'm going to check for any that capillary refill. Okay, that one's less than 3 seconds. Let me do that on the other side. That one's less than 3 seconds as well. I'm going to check your lower and upper extremities for any edema. Alrighty, I'm just going to press on you to see if you're swollen at all.
Okay.
Alrighty. No edema there. And no edema there. Can I see your hands? No edema there. And none there as well. And then can you turn to the side for me so I can look at your neck? Alrighty, no jugular vein distension on either side. That's good. And then, let me see. Alright, so all of your pulse points, you're going to have two, a carotid right here and a carotid right here. You're going to have an axillary right here, axillary right here, your brachial right here, brachial right here. And then let me feel your radial pulses right here. Okay, those are good, they're strong. I give those about 2+, they're regular. And then you have your femoral pulses on each side, your popliteal on each side right here. And then you have your posterior tibial right here. I'm going to feel those as well. Okay, those are about a 1+, they're good, they're regular. And then your dorsalis pedis right here. Okay, regular and about a 1+ on that as well. And then next I'm going to be listening to your heart, okay? And you're just going to breathe normally for me. Okay. Right here, I'm going to be in the second right intercostal space, listening to that apical pulse. Okay, S1 and S2 are present. Now moving on to the left second intercostal space, listening to that pulmonic valve. Okay, S1 and S2 are present. Now moving down to Erb's point in the third left intercostal space. Okay, now moving down to the tricuspid valve in the fourth left intercostal space. Okay, S1 and S2 are present, and now I'm going to be listening to your mitral valve for 1 minute. That's your pulse, your point of maximal impulse. Listen here for 1 minute. Alrighty, so S1 and S2 are present. Your heart rhythm was perfectly normal.
Okay.
Alrighty, and next with the safety. So you're not at fall risk at all, but in the case that you were, I'll just give you a few pointers for keeping yourself safe. So when you're at home, just try to make sure that on the floor everything's clear. If you have any carpets that are a little bit lifted or extension cords, just make sure to be aware of those. When you're moving around, or if you have any pets or anything, you just want to make sure that you know where they are so they don't trip you up. And then always make sure that you're in good lighting when you're moving around, because we don't want you to trip over anything that you can't see. But other than that, I think that's it.
Okay.
Alrighty, you have a good one.
You too.
All right.